living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Losing the sense of taste and smell is a common COVID-19 symptom, but the pandemic isn't the only threat to our senses. Age, medication, and other risk factors can also rob us of taste and smell. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. Today we're going to learn about ways to avoid that which robs our senses. Stay tuned. Welcome back to Healthy Living for Life. Joining me today is our good friend, Dr. Doug Kunzweiler, Chief Medical Officer of Mountain Pacific Quality Health. Thank you so much again for joining us.
Happy to be here.
All right, so we're going to be talking about taste and smell. Mm-hmm. Tell our viewers and me, how are they linked together?
Well, both depend on chemical receptors. For taste, obviously, it's in our tongue and lining of the mouth. And smell, it comes to us through the air, and there are receptors in our nasal cavity that receive these signals. So they're both detecting chemicals in the environment.
So how does our sense of smell change as we age? And when it changes, about what age does it start changing?
Well, like everything else, it tends to start fading as we get older. But it really depends a lot on our lifestyle, and if we've abused our senses, they're going to deteriorate faster. But even the very elderly can enjoy a good meal, and taste shouldn't go away completely if you take care of yourself.
What about taste? Is that different from smell in terms of when it might start diminishing?
Yeah, taste is pretty interesting. We think of taste as coming from the taste buds in our mouth, but actually taste buds only can identify 5 different things, and that's sweet, sour, salt, bitter, and something that the scientists who study this called umami. I'm not sure exactly what that is, but it's supposed to be a savory sort of taste. So that's fairly blunt, but 80% of our taste comes from smell. There's an interesting experiment you can do. You take a friend, you have them close their eyes, hold their nose, and you put a jelly bean in their mouth and ask them to identify the flavor. Odds are they won't be able to exactly. They will be able to tell you if it's sweet or sour. Then have them unplug their nose, give them the same jelly bean, and they should be able to identify the specific flavor. Most of our taste actually comes from smell.
So can we protect our taste and smell, and are there steps we can take to preserve?
Right, and pretty much like everything else in life, it's really avoiding things that harm our sense of taste and smell. And so these would be things that we always sort of talk about. Smoking, for one, is detrimental to both smell and taste. Being dehydrated is not good for our sense of smell and taste. Alcohol used to excess can blunt our taste and smell. Other disease states like diabetes, neurologic diseases, strokes, all of those can affect our sense of taste and smell.
How can our change in taste and smell be affected by weight gain, weight loss? What's that about?
Yeah, so this is pretty interesting. In COVID, we've renewed interest in smell and taste because that's one of the things that it can affect pretty dramatically. And what we see in people who lose their sense of taste and smell is that they just lose interest in eating. Food isn't interesting to them. And their sense of hunger alone isn't enough to make them consume enough calories. And most people who suffer this from COVID have a significant weight loss. It can be pretty dramatic.
So really that weight loss is connected to the fact that they're not enjoying what they're eating.
Exactly. Food just doesn't have any interest to them when they can't taste it or smell it.
Well, if I can't taste or smell, I'm not going to be happy about that. And so does that lead to depression?
It certainly does. And when we think about it, so much of food is a social event for us, the cooking, eating with friends and family. And when you lose an interest in food and you can't taste it anymore, it is depressing. And we've seen this clinically in people who suffer from COVID and loss of taste and smell, that they develop anxiety and they develop depression. And it's pretty significant.
So losing these two, taste and smell, can also pose safety issues, I've read. Talk to us about that. Why is it dangerous?
Well, if you think about it, we tend to underplay how sensitive our noses are, but smell can alert you to smoke and keep you from getting involved in a fire. Smell can tell us when food has gone bad and we shouldn't eat it. It can help us detect other things like gas odors and things that are a safety risk for us. So it really is fairly important.
So losing sense of taste and smell can also be symptoms of gum or dental issues. Talk to us about that.
Yeah, good oral hygiene is important to preserving it. When you have inflammation, infection going on in your mouth, it definitely affects your taste, and won't necessarily make you lose it, but it will throw taste off so that food just doesn't taste good to you.
So we've got about a minute left. Talk to us about other effects of losing our sense of taste and our smell that might have on us physically or mentally.
Yeah, there's been a lot of research lately looking at cognitive impairment and the sense of smell. Smell goes to an area of the brain that is tied to long-term memory and emotion. And when we have an alteration of memory, we also have an alteration of smell oftentimes, and these two are intimately tied together. If you think about it, sometimes there are certain smells, like maybe the smell of fresh baked bread will take you instantly back to something from your childhood, being around your grandmother cooking bread, and smell is just intimately tied to memory, and that can affect our cognition.
Well, it's time for a break, but when we come back, we're going to continue the conversation about cognitive impairment. We didn't quite finish that. We're also going to be talking about things to avoid so we don't lose our sense of taste and smell. Don't go away. Welcome back. We're still talking with Dr. Doug Kunzweiler about taste and smell. So right before the break, we were talking about the link between cognitive impairment and loss of sense of smell as an example. Talk to us more about that as it relates to dementia, Alzheimer's, and the like.
As I was saying, the sense of smell resides in the area of the brain where long-term memory and emotion also reside, and they seem to be intimately tied together. And there's been quite a bit of research done lately in what happens to people who are cognitively impaired, that is, people who are suffering from dementia. And they seem to lose the sense of smell and therefore taste along with their memory of themselves. And if you think about it, I think everybody has had the experience of a smell coming to them that recalls something from their childhood or something from their past. And it's such a vivid, visceral reaction. And our sense of who we are is in part stored in that memory, that long-term memory, and smell is a part of that.
So let's switch gears now and talk about COVID-19. So we've all read that many have lost their sense of taste and smell because of COVID. So why does COVID steal that from us?
Unlike most other viruses, COVID seems to trigger in many victims a severe inflammatory response. And in that inflammatory response, it's the body's immune system reacting to the virus. And in some people, it overreacts. It releases a lot of chemicals that actually damage the nerves that are involved in smell and taste, and at least temporarily can impair them.
So what about, we hear about long haulers, and some people, as I understand it, had COVID a year ago and they still have not regained taste and smell.
Yeah, most people who lose smell and taste with COVID, within 6 to 8 weeks, things are, if not back to normal, are getting there. But there are some people, a small percentage of people who were out 2 years now and they still haven't recovered, and it looks like it might be permanent in some cases where the nerves have actually been damaged and they're not going to regenerate themselves.
Wow. So what about other viruses that impact taste and smell?
Well, there are lots of other viruses that affect the nasal cavity, the sinuses, the mouth, the throat, but they don't seem to elicit the same inflammatory response. I think most people have had the experience of when they have a significant head cold, they have nasal congestion, they have nasal drainage, and they maybe not lose taste altogether, but taste is off for a while because you don't have that component of smell along with it. But that usually resolves in 10 days, 14 days or so, and you're back to normal. COVID is unique in that in some people it makes a much longer inflammatory response.
So we mentioned earlier medications can affect taste and smell. So talk to us about some medications that we should be on the lookout for.
Yeah, so the medicines that we use to treat nasal drainage and colds, like the antihistamines, also used to treat allergies where you have nasal drainage. By drying out the mouth, drying out the nasal lining, they can alter our sense of taste and smell. A lot of chemotherapy drugs are notorious for not necessarily taking smell and taste away, but altering it. And oftentimes people complain of a metallic taste or food just not tasting quite right to them. Other medicines too, though, even things we wouldn't normally think about. Some of the medications used in high blood pressure can alter sense of taste and smell. And in any given individual, almost any medication could affect them that way.
So if I have to be on a blood pressure medicine for whatever reason and it's affecting me, my taste and smell, is there anything I can do about that?
Well, what you should do is go back and talk to your doctor and tell him that you think this has affected you, or a pharmacist, but talk to them about it, because for most disease conditions there's more than one medication that can be used, and they can try something else.
So another cause is allergies, I've read. So talk to us about that, and what can we do?
Yeah, allergies tend to affect the airway, the throat, the mouth, the nose, nasal lining, and cause, again, irritation, inflammation, nasal drainage, stuffiness in the nose, and that inhibits the normal airflow in the nose, and that alters our sense of smell. Again, there are medications that can be used to treat that, and so you should see your provider and talk to them about it.
What about alcohol and smoking and how they impact taste, smell?
Yeah, smoking is really the big one. Smoking deadens the nerves in the mouth, alters taste, diminishes taste, deadens the nerves in the nose, and alters smell. Alcohol does the same thing. In excess, a little alcohol doesn't have much effect, but using alcohol to excess can do the same thing. We know that alcohol is a depressant and it can suppress flavors and sense of taste. The good news about both of those is that if you stop them or cut them back, you begin to improve pretty much right away, so it's never too late.
So we got about 30 seconds left. Talk to us about cancer treatment and what is there that folks can do if they are experiencing chemo and losing taste smell?
Yeah, when we say chemotherapy, it's pretty broad. There are lots of different chemotherapeutic agents, but many of them do alter taste. And the good news about that is when the therapy is over, usually within 4 to 6 weeks, people recover their taste. In the meantime, if you talk to your oncologist, there are lots of little tricks of the trade they know that help people to overcome that. Switching from metal utensils to plastic utensils is a simple thing that can make quite a difference. Using different spices, drinking tart liquids sometimes will overcome that metallic taste, so talk to your doctor.
Important message. So we're Time for another break, but when we come back, we're going to continue our conversation about losing taste and smell and what we can do about it to minimize those impacts. Welcome back to Healthy Living for Life. Joining us, Dr. Doug Kunzweiler, talking about taste and smell. So what can we do to make sure that the loss of taste and smell is not permanent? I mean, think about being temporary or permanent. What one thing would you tell our listeners?
Well, I would tell them it's worth seeing a provider about. We tend to take it for granted. We think it's not very important, but it really is important. It's a great part of the enjoyment of life, and then when we lose it, we see bad things happen: depression, social withdrawal, even cognitive decline. So my message is, if you feel like your taste is off, if you feel like your sense of smell is off, you should see a provider and talk to them about what the cause might be.
So if I see some diminishing and I see my provider, are there other things that might boost taste and smell, like hot food, cold food, spicy food?
Yeah, I think spices are something that we don't think much about, but even things like texture of food, color of food, the presentation of food, but using alternative spices, getting away from just salt and sugar and using some of the more savory spices, those can help. There's also something called smell therapy, which is actually carrying around little vials of material that have specific smells, like coffee grounds, maybe lemon oil, ammonia, something like that, and then several times a day sniffing them and seeing if you can identify them. And like the rest of our body, if you use it, it will adapt and it will strengthen, and you can train your sense of smell to be more acute by using this aromatherapy.
So when people think food is bland, a lot of us turn to salt and pepper, which salt might not be a good thing to use. So give us some examples of other spices we could substitute salt.
Yeah, so when I was a young man, salt and sugar were my spices. I didn't know there were other things, but as I've gotten older and come to enjoy cooking, there's just a world of things like cumin and coriander and curry and sage and rosemary and thyme, and then you get into nuts and oils, citrus. There's just a whole world of flavors to explore out there. And as we get older and as our taste gets to be less and less acute, using some of these other spices will perk up our interest in food. So I encourage people to explore cooking and explore alternative spices.
That is really good advice. What about being hydrated? So drinking more water, does that improve taste, smell?
Yeah, absolutely. If our mouth is dried out, our taste buds don't work as well. So good hydration promotes moisture in the mouth, which also leads to better dental hygiene. We know that a dry mouth is a mouth that's more prone to cavities, infection, and gum disease. So hydration definitely helps taste and smell both.
I would not have thought of that, so that's good advice. You talked about seeing a provider when you notice something. So when, though? Because we don't want to bother our beleaguered providers who are dealing with all kinds of things right now, right? So
Yeah.
when would I go?
If it's at the point that you've noticed it and you think it's a problem for you, then it's worth going in and talking. And again, I think we have a tendency to trivialize this, but really it's not trivial. If you have social withdrawal, if you have weight loss, those are significant problems and they are worth evaluating. So I would say don't hesitate.
Are there specialists who treat taste and smell disorders or loss of?
Yeah, ear, nose, and throat doctors are the ones. That's their area of expertise, and they have the most experience helping people that are having trouble with smell and taste. So that's who to see.
Do I need a referral from my primary care provider in order to see a specialist in ENT?
No, most of the time you don't really need a referral. I think it's a good idea to keep your primary care provider in the loop and let them know that you're going to see the ear, nose, and throat specialist, but usually self-referral is fine.
So think about what a specialist, ear, nose, and throat, might be prescribing for me, or some treatments. What might he or she prescribe?
Well, the most important thing they will do is investigate and see if they can find a cause. It might be allergy, there might be a sinus infection, you might have nasal polyps, which are benign growths that come from some source of chronic irritation. They can interfere with airflow and alter smell and therefore taste. So the important thing is that they will search for a cause, and then they will treat whatever that cause is. And it might involve medication. If there are polyps, it might involve surgically removing those. It might involve aromatherapy or smell therapy. So it just depends on what they find.
So you talked a bit, I think, about the aromatherapy. Would the ear, nose, and throat specialist refer me to another individual who would help with that?
They might, although actually it can be done fairly simply, just using common household items and little vials to carry around with you. So you might need a referral, but probably not.
Okay. So smell therapy helps with smell, obviously. And what you're saying is that would also help with taste.
Right, because as we talked about, 80% of taste comes from aroma. And if you improve aroma, you therefore improve taste as well.
So we got just a few seconds left. Any final thoughts on taste and smell?
Yeah, they are a huge part of our enjoyment of life. And so they are important. And don't minimize it. If you're having problems, see somebody about it.
Thank you so much. Very informative.
You're welcome.
And thank you, our listeners, for joining us, and I hope you will join us again next week. And until then, stay fit, stay well, stay healthy for life, with Healthy Living for Life. Take care, everyone.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.